And thank you, Secretary Becerra, for being with us today. Like millions of American families, my family has felt the impact of high prescription drug prices, and even with health insurance, patients with chronic illnesses like my daughter must navigate burdensome policies like step therapy and exorbitant bills that saddle them with outrageous out-of-pocket costs for treatments they need to be healthy. I'm pleased to see President Biden's commitment to lowering drug prices and capping costs for Americans. Can you expand on the steps that HHS will take in the coming fiscal year to ensure that price does not remain a barrier to patients' timely access to essential medication?
Congresswoman Manning, first, thank you for not just your interest, but your work, your leadership on this issue. I will tell you that the President is committed to making sure we reduce the cost of prescription medication. There's nothing that can save Americans more immediately money and also save lives than giving them access to affordable drugs. And so we're going to continue to do everything we can in this space. We obviously look forward to working with you and your colleagues to give us the real authority to do the things that will really lower the cost of prescription medication. But if Congress doesn't quite get there, we'll use whatever authorities we currently have to try to make sure that we seek more price transparency from the drug industry, and we will do everything we can to make the industry more competitive so we drop the prices as much as we can. But it sure would go a long way if Congress would help us have the ability to negotiate drug prices, for example, and to be able to seek more transparency in the way drugs are priced and marketed.
Thank you. We will continue to work on this issue because it is critically important to so many Americans. Let me move on to a different issue. The health and financial challenges of COVID-19 and the American Rescue Plan. We know that a record 14.5 million Americans now have marketplace coverage. However, states like mine, North Carolina, and 11 other states have still refused to expand Medicaid to ensure that hardworking Americans have access to insurance coverage. And this coverage gap exacerbates racial and ethnic disparities in health outcomes. What steps does the Biden administration plan to take to help close that coverage gap and reduce these inequities?
Congresswoman, thank you. As you're aware, because of your state, there are some 4 million Americans who today could have health care insurance coverage through Medicaid, but don't because of the political decisions being made at the state capitals of some 12 states. And it's unfortunate because those 4 million people suffer as a consequence of that politics. We're going to do everything we can to try to reach those people, but it's difficult because we're limited in our authorities. That's why I hope Congress is able to pass legislation through Build Back Better or whatever means you find that help close that Medicaid coverage gap. We know that there are proposals right now sitting before you. We hope you're able to get there because there is no reason why, when the law permits it, politics should prohibit it. And we think it's important that all those people get covered.
Thank you. Another area that the pandemic has shown a light on is the problem we have with maternal mortality and the access that women have to the health care they need for prenatal health, for contraception, and for a wide variety of other healthcare needs. I was pleased to see that the White House budget proposal requests a historic $400 million for the Title X Family Planning Program. Overall, how does this budget support federal efforts to address issues regarding access to high-quality maternal and reproductive care?
We're going to work as much as we can. We're dedicating $474 million to reduce maternal mortality and morbidity. You mentioned the Family Planning Services funding. We're going to do everything we can to make it clear that we want to make sure that when there's going to be a baby coming into this world, both mama and baby are in good health.
Thank you. My other colleagues have talked about the critical issues we've seen arise with mental health problems. I know my time is already almost expired, but let me just encourage you to do whatever you can to help us address this crisis of mental health problems in adults and also in our students. And I yield back the remainder of my time.
Thank you.
Thank you. Next, we'll have my distinguished colleague from Virginia, Mr. Good.
Thank you, Mr. Chairman. Thank you, Secretary.